welcome to the Narikaa Talk Show. Let's learn together and grow. So it is a moment of extreme pleasure to welcome a very acclaimed doctor, Dr. Samar Gupta, who is present with us to answer some of the very trusted questions regarding our today's topic, which is uterine endometrial cancer. I know there must be so many queries about this topic. So doctor, before we jump into the further questions, would you please like to share something about yourself?
Thank you for having me on this show. I'm Dr. Samar Gupta and I'm a specialist in gynecological cancer surgery. So I did my training in Mumbai totally from GS Medical College and my MD from JJ, after which I did spend about 2 years in UK training myself further. And then I was associated with the Tata Memorial Hospital for almost 6 years, which included a fellowship in gynecological cancer surgery. And then for the last 12 to 13 years, I've been doing private practice, trying to help women with gynecological cancers in Mumbai as well as in Raipur and Jaipur.
That's something very impressive, doctor. So doctor, what was that moment in your life when you decided to become a doctor?
Well, I come from a long line of doctors in the family. My parents were doctors, my grandfather was a doctor. So realistically, when I was very young, I didn't know anything other than medicine, and I did find it very interesting because I used to see my father go to work every day. So maybe it was back then when I was very young, 13, 14, that I decided that I think I should become a doctor.
Okay. So doctor, moving on to our further question. So my very first question from you is, what is uterine cancer?
So let's look at it this way. All women have a uterus. Uterus is the organ that actually holds the baby when they are pregnant. And cancer of this organ is known as uterine cancer. Technically, the uterus is made up of two parts. One is the inside lining and the other is the muscle. The cancer of the lining is called as endometrial cancer and the cancer in the muscle is called as a sarcoma.
And doctor, what is myometrium?
So as I was explaining, the uterus is made up of two parts, the lining, which is the endometrium, and the muscle, the muscle is called as the myometrium. The myometrium is a thick muscle that actually surrounds the uterus, and this is the one that keeps the organ in shape. It is the one that contracts and pushes the blood out during a menstrual period, and also helps to push the baby out during delivery.
My next question from you is, what is endometrium?
The inner lining of the uterus is called as the endometrium. The speciality of the endometrium is that it is a layer of cells which respond very ardently to hormones, and that is the reason why women have monthly periods. And yes, this is the endometrium, the lining of the uterus.
Okay, doctor. So doctor, are endometrial cancer and uterine cancer like the same?
So endometrial cancer is a part of uterine cancer. The uterus is a big organ, as we discussed. It is made up of the lining, which is the endometrium, and the muscles, which is the myometrium. So cancer only of the lining is called as endometrial cancer, whereas cancer of the muscle is called as sarcoma.
Alright, doctor. And doctor, next question says that, what does the uterus do?
So the uterus is one of the most complex organs that God has created, and therefore rightly so it's placed the organ only in women. The prime job of the uterus is to hold a pregnancy for 9 months and 7 days and give birth to a baby. But in order to do that, the uterus has to respond to hormones, and therefore every day that the woman is alive and every month the uterus responds to hormonal changes, preparing the uterus for a pregnancy. So that's the main job of the uterus. It prepares a woman for pregnancy every month on end, and whenever she gets pregnant, it supports the pregnancy.
Okay, all right, doctor. Doctor, what does the endometrium do?
So the endometrium, the lining of the uterus, is the one that actually holds a pregnancy when a woman is pregnant, and it is the endometrial cells that surround the pregnancy and create the sac around the baby. And therefore it is this endometrium that is most responsive to hormonal changes that a woman faces during her lifetime.
types of endometrial cancer?
So endometrial cancers are essentially of two types, type 1 and type 2. Type 1 are the cancers which are very common. Most women with endometrial cancers would have type 1 cancers. These are slow growing cancers that are responsive to hormones and are traditionally not that aggressive. Whereas type 2 cancers are the ones that appear much later in life, usually in women who are 65, 70 plus. They are extremely aggressive and fast growing cancers and not that easy to treat.
Alright, doctor. So, doctor, the next question is, what are the symptoms of endometrial cancer?
So when we talk about the symptoms of endometrial cancer, let's divide women into two categories. One, those who've finished menopause and those who've not finished menopause. So in the premenopausal age group, which is the women who are younger in their 40s and 30s and so on, any irregular bleeding from the uterus or from the vagina, which means bleeding that happens between two menstrual periods or bleeding that happens at the time of intercourse, should be taken seriously and should be evaluated. The other symptoms that women face at this age group is persistent lower abdominal pain or backache, or women who have a persistent white discharge or a yellowish discharge or a red discharge from their vagina. And these are things that are to be taken seriously. In the postmenopausal age group, it's even simpler. Any postmenopausal woman who has even a spot of bleeding, then that is considered to be a sign that needs to be taken seriously.
Alright, doctor. So, doctor, as we discussed the symptoms of endometrial cancer, so doctor, what causes endometrial cancer?
So the causes of endometrial cancer are many. The most important reason why women would get endometrial cancer today is environmental. So when you talk of environmental, it's got to do with their diet and their lifestyle. So we know today that women who are obese, who are diabetic, who are hypertensive, have a much higher chance of getting endometrial cancer than women who do not have children, who are infertile, who never had children. They have a much higher chance of getting endometrial cancer. Similarly, those girls who in their younger days have got ovarian problems like polycystic ovaries, and these girls have a much higher chance of getting endometrial cancer as they become older in their lifestyle. Besides that, there are traditional causes like women who have who start their period very early in their young age and whose periods go on to very late, like early menarche and late menopause as we say, or women who have got a very strong family history of cancers like colon cancer or breast cancer. So there's a genetic basis behind these. So these basically encompass all the reasons why women would get endometrial cancer.
What are the factors that increase the risk of endometrial cancer?
So the factors that increase the risk of endometrial cancer, most importantly, are, as we discussed, environment. So it has got to be with their diet and lifestyle. Stress plays an important part in increasing endometrial cancer. Obesity, hypertension and diabetes, as we said. In fact, that is called as syndrome X, and which is a big part of endometrial cancer.
Okay. Doctor, my next question is how to diagnose endometrial cancer?
So women who present to us or come to our clinic with irregular bleeding, as we discussed earlier, these women, we evaluate them for endometrial cancer. The first test that one does for them actually is an ultrasonography or an ultrasound. More sensitive is what we call as a transvaginal ultrasound, where we look for the thickness of the lining of the uterus, that is the endometrial thickness. You also look for other things in the endometrium like an ulcer or a growth or a tumor or a polyp, and we also look at whether the uterus is enlarged or smaller. So an ultrasound is the very first thing that one does. This is followed by what is called as an endometrial biopsy, where we take a small piece of the thickened lining or the irregular or the abnormal lining and send it to the lab for studies. This endometrial biopsy can be done via a hysteroscope, which is a telescope that is put inside the uterus from below, or it can be done by a standard procedure which is tried and tested all over the world called the dilatation and the curettage. There are many such ways, but the basis is that you take a small sample, send it to the lab, and the lab gives us a diagnosis. Once the diagnosis is confirmed, then obviously other tests come into the picture, like the CT scan and the MRI and other blood tests.
All right, doctor. So, doctor, this brings us to our next question that says, what else does an endometrial cancer diagnosis show?
So, in today's day and age, women who are diagnosed with endometrial cancer, one looks at local and systemic conditions for them. So local conditions could be, one needs to figure out whether she had a history of cancers in her family, in her mother, sisters, or on her father's side. One looks and asks her about a history of colon cancer, rectum cancer in their families, even ovarian and breast cancers. And if that's the case, then one needs to actually advise these women to have a genetic test to determine these conditions. The other thing is, when we diagnose a woman with endometrial cancer, we look at most of the common associated factors. We often check their blood sugars because we realize that these women are often diabetic. We need to see their blood pressure and see whether they are hypertensive. So all of these things can coexist together. So at the end of the day, we are treating a human being and not cancer, diseases separate.
So my next question is, what are the treatment options for endometrial cancer?
So the treatment options for endometrial cancer essentially are surgically driven. The standard treatment for endometrial cancer would be a surgery to remove the uterus and the ovaries and a lot of other structures around, depending upon the type of cancer. Once this is done, again the laboratory gives us a pathology report based on which we can advise radiation therapy or chemotherapy, immunotherapy or targeted therapy. So these are the various kinds of treatment options that are available. Treatment options also depend upon the age of the patient and her general condition to withstand treatment.
So doctor, my next question from you is, what type of uterine cancer surgery will a person need?
So surgery for uterine cancer depends primarily upon the age of the patient. If a patient is young, has not yet completed a family, and it's a very early stage cancer, then one can avoid removing the uterus and give other forms of treatment like hormonal therapy. But by and large, most patients with uterine cancer will require a surgery that involves removal of the entire uterus, the fallopian tubes, the ovaries, and the lymph nodes, and sometimes even the omentum, which are organs inside the body to which the cancer can spread. These procedures can be done by the gold standard method, which is open surgery, where one takes a cut on the abdomen and does it. And in today's day and age, we also use minimal access, which is either laparoscopic surgery or robotic surgery to do these procedures.
Okay, doctor. And doctor, does a woman need to have her ovaries removed?
That's a very interesting question. The traditional thought is that endometrial cancer is hormonally driven and therefore the ovaries need to be removed. But we know today that in younger women with very early stage non-aggressive cancers, one can actually keep the ovaries inside and just remove the uterus. But this decision has to be taken after explaining all the pros and cons to the patient and after doing all the tests to make sure that it's a very early stage, early grade cancer.
Doctor, my next question from you is that what can a woman expect after uterine surgery?
Well, after removing the uterus for endometrial cancer, obviously there is a recovery period which ranges from 3 days to 6 days depending upon whether it was a minimal access surgery or an open surgery. But by and large, after that, within the next 10 to 12 days, most women recover very well and can go back to their normal day-to-day routines without any problems or any troubles. As far as changes in their body after removing the uterus, there are none, simply because one is removing an organ which is diseased and which needs to come out in any case. So a lot of women feel much better after this surgery.
Okay, doctor. And doctor, how is uterine cancer treated?
So treatment of uterine cancer is on similar lines as treatment of endometrial cancer. The primary form of treatment is surgery, where one needs to, in this case, obviously remove the uterus, the ovaries, and the surrounding structures to which the cancer can spread, and again subject that to laboratory evaluation. Based on what we get in the pathology report, then we decide whether the women would benefit with radiation therapy, chemotherapy, with or without immunotherapy and targeted therapy, which are the new modalities of treatment nowadays.
Okay, doctor. So, doctor, can uterine cancer be prevented?
Well, yes and no. Uterine cancer can and cannot be prevented. Now, those women who are genetically prone to getting uterine cancer will more or less get uterine cancer at some point of time in their lifetime. The idea is to try and diagnose or identify these women so that they can be treated before the cancer develops. But in most other women, uterine cancer prevention is what we call as lifestyle changing methods. So women who are obese are encouraged to lose weight. Women are encouraged to eat healthy and lead a healthy lifestyle so that they don't become diabetic or hypertensive, and this reduces their chances of getting uterine cancer. But by and large, these are diseases that have no preventive tablet or mechanism.
Doctor, will ERT, which is also known as estrogen replacement therapy, make a woman more likely to get uterine cancer?
So there has been a lot of things that have been written and mentioned about estrogen replacement therapy. Yes, estrogen replacement therapy does increase the risk of getting uterine cancer, but if estrogen replacement therapy is given in a very monitored fashion with regular supervision from a medical person, then one can actually diagnose changes happening in the uterus very early and treat pre-invasive or pre-cancerous changes that happen in the uterus also.
Alright, doctor. Doctor, is there a screening test for uterine cancer?
Screening test for uterine cancer, unfortunately there is no proven test that would be able to screen and pick up uterine cancers very early on. But as a routine, what we advise women of all age groups is that whenever they go for their annual check, we ask them to get a pap smear of the cervix done at least once in 3 years. We ask them to get an ultrasound done in their annual check at least once a year, and that can diagnose abnormalities in the uterus and the cervix, which may or may not be cancerous, but at least one would pick up abnormalities and take it from there onwards. But the biggest and the most the thing that will prevent uterine cancer maximally is that any woman who has any symptoms of bleeding from their vagina which is abnormal or not the usual, please don't delay it and go to your doctor as soon as possible.
Okay, doctor. Doctor, next question is, what are the stages of endometrial cancer?
So when it comes to stages of endometrial cancer, classically there are 4 stages of any cancer, and so with endometrial cancer also. The first stage is when the cancer is limited only to the uterus. The second stage is when it goes beyond the uterus to the lower part of the uterus called the cervix. In the third stage, the cancer actually spreads outside the uterus and involves the ovaries, the fallopian tubes, the lymph nodes. And fourth and final stage obviously is where it involves spreads far away to the liver or the lungs or distant areas through the blood vessels.
Doctor, my next question is, how do we reduce the risk of endometrial cancer?
So to reduce the risk of endometrial cancer, the most important point is lifestyle modification, which everyone knows what to do but very few do it. It's very important to get regular exercise, good sleep, healthy eating habits, weight reduction, keep yourself physically fit, under good check, so that if you have diabetes or blood pressure, you should treat it often. And I think that's the most important way to prevent endometrial cancer.
Okay, doctor. So similar to your answer, doctor, my next question is, can uterine cancer be cured?
Like any other cancer, even uterine cancer can be cured. However, provided you catch it in the early stages. So when we catch uterine cancers or endometrial cancers in the stage 1, 2 or maybe early stage 3, it is possible to try and cure them. So the idea is to catch them early, only then we can effect a cure.
Alright, doctor. And doctor, when should a woman see her healthcare provider?
So I would encourage all women to keep a close eye on their bodies because they know it the best. At any point of time, if you feel that the discharge that you will have from the vagina is more or less than usual, or it is smelly, or if you have any bleeding episodes that are irregular, that do not fit in with the regular pattern, then please don't neglect it. Please go to your healthcare provider and ask for a reason for the same.
Well, doctor, that was a great response, and we are so glad to have you on a Narikaa Talk Show. So thank you so much for taking out some time out of your busy schedule. So, well, this was all for today's episode. We will meet you in the next episode with another exciting topic. Till then, to all our lovely viewers, stay happy, stay safe, and stay